Hello. With this video, we share some different aspects of our digital clinic platform and some of the qualities that helps it to process millions of dollars of telehealth cases end to end every week. This quick video is about our experience of working with entrepreneurs and also doctors from the medical establishment and how they have influenced our strategy in the design and development of digital clinics. I hope you'll gather some insights into our platform and that maybe you'll raise some questions and challenge us to design even better solutions in the future, maybe for your own business. I am Ian Morrison, Product Manager for TeleHealth and Digital Clinic Designer.
When people think of telehealth, most people think video calls. To get it right, we need to think bigger. Let's define telehealth by the qualities that it brings to healthcare. Telehealth is about the digitization of the healthcare value chain, not just video calls. Telehealth is a care delivery model, taking advantage of digital technologies from patient acquisition, consulting, diagnostics, and delivery. Telehealth substitutes and complements in-person visits. They can still send test kits, use remote diagnostics, or even send a caregiver to your home. Telehealth conjures up visions of digital clinics where my team and I are now spending our time. In the modern world, folks are quite tech savvy. Not just our patients, but our staff and providers are now working remotely, sometimes all over the world. In the modern world, patients demand instant and professional gratification. They expect the same high-quality digital experiences from all of their online engagements. These are the service values that will bring them back to clinics and generate revenues for their shareholders. To bring technology into the modern world, there's always tension between evolution and revolution. Religions have been established to debate the merits of different approaches and justify methodologies such as Agile. We see this played out every day as we bridge the world of digital with its cool capabilities and visions of the future, with the very real and very human world of healthcare. We seek to bring the awesome benefits of digital without losing, but hopefully empowering and enabling the human relationships that are at the core of effective healthcare delivery. Let's build a bridge between the two worlds and find a sweet spot that balances evolution and revolution for each clinic's distinct needs. Evolution is demanded by the industry itself. We work with many stakeholders and existing healthcare groups to explain our ideas. We need to hold their hand and know when they are ready to adapt. We also need to understand their vision of best medical practice, compliance requirements, and the nature of value exchange between their stakeholders. Learning about their operations, we find that using digital to evolve existing processes releases a lot of operational efficiency and performance gains when introduced carefully. Revolution is pushed for by young and thrusting entrepreneurs. These guys can go faster, but they do need to learn the lexicon, the processes, the standards and requirements of the industry. Otherwise, they risk missing out on systems that are proven to work and are sure to be comfortable to use, comprehensive and compliant. I'm continuing to develop my own view of the optimized digital healthcare value chain and what a pure digital clinic should look like. I really enjoy learning about new technologies and new business ideas from entrepreneurs who want to establish their own digital clinics. As noted, we have a number of operations around the globe tackling different medical specialties and are excited to add more to our portfolio. Sweet spot. We believe that digital revolution comes through evolution. Let's also add some intense collaboration to speed this along. The healthcare ecosystem is too integrated and bound together with existing systems to change everything in one go. We'll get to 200 billion and much, much more very easily. Just one hospital we work with does 1 billion annually in consultations. Imagine the revenues once they convert a significant percentage of that to digital in the coming years. The industry will go through many stages of global transformation and automation, with a good dash of innovation along the way. It's up to us to learn best medical practices before trying to change behaviors or impose new and different ways of doing things. If we want to transform the industry, let's look at a very simplified view of the value chain. We identify key stakeholders and what they look for in telehealth solutions. Our patients, they need us to take care of them, providing them with intuitive and easy to use digital tools for them to manage their health and relationships with the clinic. Our providers, they need the tools to make their job easier and faster. They need the latitude to do their job. They want to see more patients and to make more money. Health suppliers, so our pharmacies and diagnostics firms, they need assurance of compliance and professionalism as we take up their valuable time to integrate them into our clinic's ecosystem. The folks who administer the clinic's operating platform need effective and compliant automation of essential operations. They need real-time collaboration to give them the speed of service that customers demand. Our shareholders, well, they want money, don't they? They want to see costs reduced through the application of digital technologies. They also want to see their clinic growing on the back of continual digital innovation. Clinics need to use digital to manage their relationship with patients. Let's call this channel management. Customer-facing parts of the value chain that can and really should be digitized are marketing, sales, scheduling, and that all-important teleconsult. Sharing patient-friendly information, to me that means digital, on appointment schedule, test results, diagnostics and action plans is the easiest way to build relationships about the most important thing in their lives, their health. We have lots of fun designing and managing patient-facing websites and apps. We feel we have a good sense of the CRM methods and touch points to manage patient onboarding, case intake, to manage consults, and the follow-up communication needed to add a modern-day digital channel to the business. We need to work with chief medical officers to identify how best to support their providers. We look into how they administer cases, how they operate their diagnostic processes, and prescribe their action plans. The workflows and tools that deliver new cases to doctors, support the work that they do, and automate their documentation considerably boost their productivity. The clinic needs a professional approach to digital integration with testing labs, pharmacies, diagnostic equipment, and other third parties. We need to have APIs ready to go for any purpose that might require a hookup. Transforming operations, to us, is all about the case processing pipeline, different for every medical speciality. Into the pipeline comes sick patients. We then do many cool and complicated things to give them the best of care that we can. Then, on the output side, we generate happy patients and, critically, billable events. To transform the case processing pipeline, we need to understand the business rules. These drive the administrative processes and help us to automate much of the clinic's operations. Let's add real-time collaboration tools deeply into our digital workflow. The clinic can integrate text messaging into case notes. The clinic can let admin and providers, they can call each other from their customized dashboards. Operations can be built around a rich video consultation toolset, not just Zoom for doctors. A little extra thinking and industry advice helps assure us that all processes are compliant, no matter the jurisdiction. Above all, operations have to be effective. I can report that our core platform already delivers thousands of consults per day in many medical areas all around the world. Let's not allow our digital gurus and engineers to forget that our digital clinic is first and foremost a business. Every business is a money-making machine, and every complex machine needs a dashboard. With a good set of dials and levers, managers should be able to transparently and in real time see how well the engine is working. CEOs should be able to see how much business we're doing with all the partners in the ecosystem and manage the portfolio of remote working providers and administrators. CFOs should be able to see consultation revenues and key drivers of costs. COOs should be able to see how well their case processing pipeline is operating. They should be able to measure performance against KPIs for each process and for each stakeholder. They need to know about any bottleneck in the delivery of the best of possible patient care. CMOs should be able to learn about the patients. Where do they come from? What services do they want? And how often do they come back? The digital healthcare revolution has 3 dimensions to consider in our product strategy. We want to acquire more patients, designing the best of user experiences to grow the brand and build a reputation for excellent service that earns repeat custom and referrals. We want to reduce costs using the power of digital processes to keep things going efficient and fast and a delight to use. We want to add more value, finding and integrating the right technology innovations that can revolutionize such as diagnostics and the delivery of care. Every business wants to acquire more customers. According to McKinsey, the area of competition for digital clinics is patient channel development, an area in which so many perform badly. Success requires a number of qualities built into the front end and to span a typical customer journey. From 1, content marketing, and 2, CRM systems that work the funnel of 3, easy booking tools, through 4, comprehensive schedule management, to 5, built-in teleconsulting, and 6, shared customer records that confirm diagnosis and details of action plans. Lots of stuff to consider. Every business wants to reduce costs. This can be achieved by applying the best of digital practice and process transformation. There are many opportunities to achieve significant efficiencies. Patient relationships can be a lot more intuitive. A good digital clinic will drive patient engagement, information gathering, and appointment scheduling. Case administration can be much more efficient with automated workflows, maximizing provider availability, supporting real-time collaboration, and promoting massive case volume. An awful lot of paperwork can be completely automated. We can digitize, but need not eliminate, as we automate the composition of thousands of different documents, ensuring full compliance. And finally, we can track all commercial activities. We strongly believe we should let doctors be doctors and empower them to do their job, automating existing processes. We use technology to reduce unnecessary work and make the processes seamless. Technology can add more value. Beyond automation, we see lots of cool new health tech that can be added to clinics. These can really empower our doctors. We have worked on making the diagnostics workflow smarter, digitizing the management of medications, ICD-10 codes, and such as template SOAP notes and requisition forms. Many clinics already engage electronically with healthcare data systems, diagnostic partners, and healthcare providers. We see monitoring technology and sexy new real-time reporting solutions. AI diagnostics will surely have an impact one day too. We still want to let doctors be doctors though. Let me take you through the story of our own evolving experience in telehealth. Many of our early projects started out with simple digital video consulting. We then started using digital to set up brand new clinics, and we now have been let loose on complete end-to-end case management cycles. There, we have found significant strategic and commercial advantage for our clients. One major American clinic we totally transformed has been able to significantly multiply its caseload without hiring. We have seen firsthand how digital advantage can bring significant benefits to all existing areas of its operation. Pretty much doubled overall capacity. We help significantly with customer retention. We allow providers to spend much less time per patient and substantially relieve staff of tedious work in quality control and compliance.
Thanks for watching. To turn this video into conversation, do drop me a line. The numbers on the screen, or visit our website, virtualcaresolutions.com. That's virtual-care-solutions.com. Again, thank you for watching. Bye-bye.